So this is the question I get all the time. Doc, my neck bothers me. My face is fine. I don't have any issues with my face. I hear this all the time. And that's because our attention oftentimes goes to the thing that bothers us the most. And having a loose, sagging, or waddle under the neck is something that really bothers people. So what ends up happening, a lot of people seek a treatment that directly addresses that looseness or that heaviness under the neck. The problem is people don't understand the anatomy. And I'm speaking specifically here of a standalone neck lift procedure, which a lot of surgeons still do and advocate for. And I want you to understand this so that you can be in a good position to advocate for yourself and make good decisions. But here's been my experience. When you're aging and you're in your late 40s and 50s and beyond, the source of the neck laxity is not the neck, it's the face, because the face is where the platysma muscle attaches. And when the platysma muscle begins to lose its upper anchor as the face starts to sag, well, what naturally happens is the neck begins to sag with it because nothing is holding it up against the jawline and redraping into that beautiful, youthful neck contour. So when you go in here and directly try to either snip that muscle or plicate that muscle and trying to do a neck lift, without elevating and supporting the platysma up top, what ends up happening is as the months and years go by, that neck just starts to sag even more. And oftentimes leaving it with a kind of a really an unusual or an unnatural look to it. So my strong opinion in this case is an aging neck needs to be treated by vertical elevation of the SMAS, which is attached to the platysma muscle holding the neck up. This is the practice that I have seen works every single time and works beautifully and gives durable, long-lasting results. And that's the foundation, that's the fundamental way of treating the neck. Now, in general, I give this a 1 or 2 out of 10. It might give you a temporary type of an improvement, but in the long run, it's going to fail you and you're going to be upset about it. But who would potentially benefit from a neck lift? Generally speaking, if you're on the younger side, if you're in your 20s, 30s, or maybe even early 40s, and you have absolutely no laxity as part of the equation, but just have fullness under your neck, then an isolated neck lift because of that genetic fullness under the chin is a perfect solution. And we've done that for patients, and I think there's nothing wrong with that because it removes that heaviness out of the tissue and gets that neck looking slender and more defined. But if you're aging, a neck lift by itself isn't going to get you anywhere. You're going to be right back on the operating table before you know it, wanting to get that neck back up.